Good morning, everyone. Thank you for joining us today for the final annual general meeting of South West London Clinical Commissioning Group. I'm Nicola Jones, and I was the clinical chair for the CCG for its final 3 months, and I was vice chair before that, having previously been chair of Wandsworth CCG for 10 years, and I'm going to be chairing this morning's meeting, so a very warm welcome to all of you. You will already know that South West London CCG closed on the 30th of June 2022, and we've since been established as the South West London Integrated Care System. That was from the 1st of July. And we had the opportunity to say goodbye and thank you to everyone involved in the CCG at our final meeting that was held on the 22nd of June. So we're conducting this annual general meeting as part of our duties to meet NHS England's statutory requirements. And before we begin, I just want to remind everyone of some housekeeping rules to help us run the meeting smoothly. Firstly, the meeting's being recorded, and we're going to be sharing the recording on our website after the meeting. Can I please request that everyone turn off their cameras and ensure that they're on mute unless it's your turn to speak? And the chat function is open for you to ask any questions you may have during any part of the meeting. And we've got colleagues monitoring the chat, so we'll endeavour to get through as many questions as possible after all the presentations have been completed. So our running order for this morning starts with Neil McDowell, Director of Finance, who'll go through our annual accounts from the previous financial year. So we're talking about April 21 to March 22. And then we'll hear from Karen Broughton, our Deputy Chief Executive, and she'll share with you highlights of what we've achieved in the previous reporting year. Karen will be followed by Sarah Blow, our South West London Integrated Care Systems Chief Exec, and Sarah will speak about establishing the South West London Integrated Care Board and the Integrated Care System and about our ambitions for the future. And then the final part of the meeting will be your opportunity to ask questions, and this will be compared by Charlotte Gorn, Executive Director for Communications and Engagement. So I'll now pass over to Neil, who'll go through the CCG's annual accounts.
Thanks, Nicola. So, yeah, my name is Neil McDowell. I'm Director of Finance for the CCG. I'm just going to take you through the annual accounts for 21-22, picking out some key points, in particular where we spend our money and what the key targets are for the CCG. So looking at the first slide, we can see that the CCG receives an allocation to spend on its population, which is £3.1 billion. So this is used to buy health services on behalf of the 1.5 million people in South West London, which is just over £2,000 per head of weighted population. We have a statutory obligation to not exceed this allocation. We may on occasions be asked to underspend against that allocation, but for 21-22 the requirement was just to hit a break-even plan. So we managed to deliver this, and also the CCG has to operate within the 30.9 million for its administration of its corporate functions, and again this target was met. So next slide, please. So where do we spend our £3.1 billion? So I think the pie chart to the right highlights that we spend over half of our budget on acute services. So this would include all our local acute providers, so with St George's, Croydon, Kingston, Epsom, St Helier, as well as contracts with hospitals outside of South West London. The significant other areas of note are around mental health services, which would include South West London and St George's in all of our boroughs apart from Croydon, where most of those services in secondary care sections would be with South London and the Maudsley. In terms of primary care, this is sort of split into two elements. You've got the primary care co-commissioning, which is the amount of money that we spend with the doctor's services, so the sort of services that we get through the GPs. But in addition, we have some local primary care services as well as the cost of prescriptions. You will also note that the running costs within this pie chart represents 1% of our total allocation. And then moving on to the next slide, which is my final slide, and to sum up where we are. So in terms of this, we have done by managing to break even. We also have to demonstrate value for money, for which the auditors have passed a positive opinion. We're also required to invest in mental health services in at least the growth in our allocation, which we have, and we actually exceeded that target. And we also have to stay within our admin target, which, as I said before, we have. So I think that concludes what has been a successful end to the financial year for 21-22 from a financial perspective. And I'll hand back now to Nicola.
Thank you, Neil. So much work distilled into a few minutes. Excellent. So can I now ask Karen Broughton, Deputy Chief Executive, to talk to us about some of the highlights and achievements of the CCG through 2021-22.
Thank you, Nicola. Can we go to the next slide, please? So in this part of the AGM, I wanted to take some time just to reflect on some of the CCG's key achievements over the final year and beyond of its existence. I'm not sure if it's just me, but the slides haven't moved on. Has anybody else's slides moved on?
They've now moved on, Karen.
Okay. Looking back, the CCG actually achieved a huge amount in the last year of its existence and before that, including responding to the COVID-19 pandemic. And it's impossible to cover all those things, I suppose, in the time that we have, but I hope the high level summary that we gives a flavour of some of the work of the CCG and also some of the work that's happened in the boroughs that make up South West London. Next slide, please. I can't see the slides, so maybe someone will tell me when they've moved. The first slide is around responding to the pandemic. The COVID pandemic, as we know, was one of the biggest challenges faced by the NHS, actually the country as well, and partners across South West London, including our local authority colleagues, the NHS, the voluntary sector, all worked incredibly hard together to make sure that patients were cared for and looked after and that essential services were kept running during the pandemic. In the NHS, we all remember the enormous effort and commitment that we saw from our NHS clinicians and our NHS staff. We led the response to the COVID pandemic through the CCG. Would you mind just going back one slide? Thank you. And to respond to the changing nature, because if we remember, COVID changed its nature quite a few times during its time with us and continues to do so actually. And in the NHS in South West London, we rapidly adapted services to keep patients safe and well and cared for, those with and without COVID, so that care could be provided. We developed new ways to support patients out of hospital. We began to use virtual appointments for the first time. We began to bring in new ways of testing, so things like pulse oximetry that look at oxygen saturation levels but measures that at home. We focused on those patients with the greatest needs to make sure they were safe. We increased our virtual access to primary care, to outpatients, to mental health services, so people continue to get care in a slightly different way, but we're still receiving care from the NHS during COVID time. And we increased our support to South West London's care homes through GP leads, primary and pharmacy support, therapy teams, infection control support, and also through technology. Next slide, please. And we all remember the COVID vaccination programme. From the start of the COVID programme, from the 8th of December to the end of June, when the CCG ceased to exist, we saw over 300 million COVID vaccinations being administered. And this is the biggest vaccination programme the NHS has ever seen. In order to do that, we deployed 1,500 workers to deliver those vaccines. We listened to communities, we listened to what we were being told by them, we looked at the data, and we used that feedback to set up pop-up clinics in mosques, in temples, in churches, in community centres, to make sure that we reached those communities with lower uptake of the vaccine. It was really important that we answered people's questions during that time, and we held over 250 engagement events between December and September 2021. And our local clinicians reached over 8,000 people in a range of face-to-face on-screen sessions where the questions that were in people's mind were answered by clinicians. The South West London CCG engagement team worked with clinicians, the voluntary sector and key community groups at borough level to make sure that we helped people in those areas where uptake was slow, to reassure them on the safety of the vaccination and to dispel the myths that were circulating on social media at the time. In each borough, we worked with our local councils to develop targeted engagement plans and with voluntary sector partners to make sure that we engage with communities. And use that information to locate pop-up clinics, etc. So really listening and using the information that we were receiving to make sure that our response met those needs. We also funded the voluntary sector to reach deep into communities, to engage with different groups and have conversations with people to make sure they had all the information they needed on the vaccine. And the vaccine programme was dependent on enormous effort. The CCG staff, GPs, trust clinical colleagues, including our COVID matrons, and of course the hundreds of people that joined us to volunteer and support the NHS during that time. Next slide, please. But we remained focused on reducing health inequalities, and that will continue to be a key objective for both the Integrated Care Board and the Integrated Care System as we move forward. But some examples of where we've worked as a CCG to reduce health inequalities included commissioning the Ethnicity and Mental Health Improvement Project in Wandsworth to help improve Black people's experience of accessing mental health support and treatment. We supported vulnerable residents in Sutton who were living in social housing by collaborating with the Social Housing Partnership to create accessible health and wellbeing events. Health and Care Voluntary Services came together to support 140 people in Kingston and Richmond who were experiencing homelessness, who were refugees or asylum seekers, to make sure that health and wellbeing days were available to those people too. We worked with people with severe mental illness in Merton to increase participation in the uptake of annual health checks. We improved our recruitment and our way of working within the CCG to make sure that our CCG staff experiences and opportunities were increased for our Black, Asian and minority ethnic colleagues as a part of our commitment to workforce race equality. Next slide, please. And we continue to work together to join up and transform services in South West London. Next slide, please. By bringing people together to deliver. And there are a number of examples. It's really difficult to pick them out. But on this slide, so you'll see we've got virtual wards, we've got the peddling paramedic, mental health crisis cafe in Sutton for adults, blood pressure checks, and then long COVID support in Richmond. And that's the one I'm going to just concentrate on. So we began to understand COVID, didn't we? And we began to understand the longer term effects of COVID. And in Richmond, Hounslow and Richmond Community Healthcare created a long COVID service. And that brought together from staff from community, primary care, respiratory and Richmond's wellbeing services. The service has been helping people with long COVID across Kingston and Richmond since it launched in November 2021. And their patients have therapy in the best place that suits them. So for some, it will be an outpatient appointment at Richmond Rehabilitation Unit. For others, it will be an online video or a telephone consultation. And for others, it will be in their home. And through this service, people get help with managing their long COVID symptoms. And the team give advice on self-care, sleep, diet, mood, exercise, and other activities that can support recovery. Patients start with an initial assessment and they develop a personalised plan to make sure that we treat them and their conditions and their priorities. Next slide, please. And there are two examples here just to give you a little bit more information about. So the first example is Wandsworth Children and Adolescent Mental Health Services, or CAMS for short. The CCG increased investment in children and young people's mental health from 3.2 million per year to 7.5 million per year, and increased its focus on supporting children with autism and other social, emotional and communication needs. The services include pre-diagnostic support for families, much quicker neurodevelopmental assessments, early intervention from new multidisciplinary teams in Wandsworth's Autism Advisory Service, drama therapy provision in schools, new behaviour analysts being appointed, and key workers too. And we've had increasing success intervening and breaking cycles of crisis for those citizens who are at risk of admission to hospital. And then in the other example, the Croydon Health and Wellbeing Space. So based in Croydon's Whitgift Centre, this is a partnership with Croydon's Black and Minority Ethnic Forum and Mind. And the Health and Wellbeing Space aims to provide an inclusive and safe space to transform health and wellbeing of Croydon residents. The free service provides a safe space for those people aged over 18 to connect and gain advice and support from a range of essential services, including psychologists, mental health nurses, etc. And since its launch in January 2022, the hub supported nearly 100 people in this way. Next slide, please. And we've also made sure that we continue to listen to what's important to people. We work on behalf of every resident in South West London, and it's vital, therefore, that we understand what's important to them and make sure that those people and those communities are included in our planning and our decision making. So some examples here. So building our future hospitals, improving healthcare together, a brand new hospital in Sutton. We looked at, I'm just seeing if this is, yeah, okay. We looked at the services and the hospital. In July 2020, Committees in Common for South West London and Surrey Heartland reviews evidence, business case and feedback from a 12-week consultation and approved £500 million investment in Epsom St Helier hospitals and a new specialist hospital to be built in Sutton. And in November 2022, that decision was ratified by the Secretary of State for Health and Social Care. And the Trust are now taking forward the programme under Building Your Future Hospitals. And I suppose one of the themes throughout that has been engagement with local people and local communities. And recently they've been invited to give their views on early design of the new specialist emergency care hospital in Sutton. The second bullet here is around a pathway redesign. And I'm just going to give you the example of urology, so diseases of the urinary tract, prostate, kidneys, bladder, etc. So in Merton, a project was launched to get men talking about urology using informal drop-in sessions, and this was put together because we began to see a fall in people coming forward with symptoms during the pandemic. And through those sessions and those conversations, we were able to demystify bladder and prostate problems that can be a sign of cancer. Next slide, please. And throughout the time, South West London Trusts have been working together to improve care and reduce waiting times. So normal NHS services were severely disrupted during the COVID pandemic, creating a huge challenge to address the number of patients who are waiting for surgery and diagnostic services. And our recovery programme was led by 15 recovery clinical networks, each involving hospital and primary care clinicians, community providers, medicines management professionals, mental health and nursing colleagues, and allied health professionals. And we have been increasing planned surgery. So locally, our 4 trusts, St George's, Epsom and St Helier, Kingston and Croydon, have worked together with primary care colleagues to reduce the number of waiting, and they continue to work on. And some of the things and some of the successes have included South West London's elective orthopaedic centre expanding its capacity with additional operating theatres, which means that an additional 1,500 people can be treated each year. St George's built a new surgery treatment centre at Queen Mary's Hospital in Roehampton with 4 operating theatres and a recovery area. And in Croydon, Croydon's an active care centre, a hospital within a hospital, is safely treating over 18,500 people, providing around 300 patients a week with routine or planned surgery treatment, a 10% increase since pre-lockdown levels. Next slide, please. And I touched on urology and the drop-ins that had been happening, but actually much more has happened around urology. So before COVID, patients' experience of urology differed depending on where they lived. Dedicated hubs were created, and that gave us the opportunity to standardise care, working as a single South West London system rather than 6 boroughs or 5 hospitals. And through this initiative, we were able to agree a range of treatment options across South West London, and something that would normally take years took months, because people began to work in the spirit of coming together in the way that the ICS is created to do so now. We now treat urology as a long-term condition, not a surgical specialty that's confined to hospitals. And I think through this, and if you've ever heard Dr. Vassar talk, clinical leadership has been key here. So really people coming together from hospitals, community-based clinicians, working as pairs, supported by managers, including nurse specialists, doctors, pharmacists, meeting regularly to make sure that actually the services provide more care in a different way to patients, and patient care being improved as a result of that initiative. Next slide, please. And the CCG has continued to improve primary care across South West London. So we have created 39 primary care networks to strengthen primary care. And during COVID, those primary care networks were at the forefront of delivering the COVID vaccines and through the vaccination centres. They've continued to develop and are helping to coordinate services and new ways of working in primary care to respond to patient need. And going forward, the ICS places will continue to support primary care network development and focus. But just some things to pull out really. In response to the initial COVID, we saw people being treated very differently in primary care. We changed the way that primary care saw and treated patients, so GP practices here, separating patients with and without COVID. We developed respiratory pathways in primary care to care for people with this new condition. We introduced new infection control prevention measures, introducing screening in practices and personal protective equipment. We added video consultations and video calls so that people could continue to receive care. And we ensured that people who needed to continue to be seen face-to-face were able to do so. So our initial response changed and responded to the way that the challenges of COVID dictated. We also responded and made sure that we focused on the most vulnerable. So we're focusing our routine work on populations that were at higher risk of poorer health. So people with long-term conditions or learning disabilities, for example. And we work closer than ever with our partners in the care sector to support them through the pandemic, particularly with infection prevention and control. And I've already mentioned the vaccination programme. So GP practices in South West London working together with those primary care networks to deliver vaccine to the people in local communities through a range of dedicated vaccination sites. And our Primary Care Provider Alliance giving additional capacity on weekends and bank holidays, particularly during December and January of last year. And this gave patients a number to call, the ability to talk to someone about their need, and also to access care where needed. And that support gave about 10,500 people care in that way, with 87% of those patients getting advice and care via the telephone, and the remainder being seen face to face. And the final bullet here is around the increase in clinical roles that we've seen throughout primary care. So primary care networks continuing to develop during 21 and 22, particularly around their workforce, making use of some schemes and funds that came down from NHS England. But we now see in primary care a range of different roles, including clinical pharmacists, first contact paramedics and first contact physiotherapies, and mental health workers, to make sure that actually we continue to respond to patients' needs locally. Next slide, please. We have also continued to work together to prevent ill health. So prevention is always better than cure, and the CCGs continue to develop models for identifying patients at risk of deterioration so that timely care is provided. And an example of this is the work being done in Kingston and Richmond on Proactive Anticipatory Care Model, or PAC. Next slide, please. I'm just going to tell you a little bit more about PAC. So it was launched in May 2021. It considers population segmentation, so members of the public and the population that have particular health needs. It looks at the risk stratification of those needs, and it uses clinical judgment to identify people who would benefit from a different multidisciplinary team approach to their care. And in this example, multidisciplinary staff from primary and community care, social care and the voluntary sector provide support to patients often in their own home, with team members dedicating time for those meetings where professionals come together and consider the whole care and needs of the patients, and outside of the meetings to discuss and progress actions and care plans for those patients so that patients really receive personalised care. And to date, over 500 patient discussions have taken place in the New Morden and Worcester Park Primary Care Network, and just under 600 in the Teddington PCN. So really making sure that those with greatest need, those with complex needs, have personalised support and care around them. Next slide, please. And then prior to the close down of the CCG, we wanted to make sure that the work of our staff and the things that they were proud of were recorded. And so we did this through the One Thing I'm Proud Of campaign, which really gave staff in the CCG the opportunity to say what they were proud of and the things that they feel the CCG has achieved during its life. Next slide, please. And then finally, on behalf of South West London CCG, I want to end by saying thank you. Thank you to all those that have been involved in the work of the CCG over the years, to our citizens, our volunteers, our staff, our clinicians and our partners. The work of the CCG and the relationships that it has developed across South West London organisations and people provides a really strong platform for the integrated care system going forward. We hope that you will stay involved and connected with the new integrated care system and all the work that we still need to do in South West London to continue to improve health and care in our 6 places that make up South West London. Thank you, Nicola.
Karen, thank you. And I'd like to reiterate what Karen has just said and add my personal thanks to everyone. Many of you are with us today. So thank you to our staff, clinicians, primary and secondary care colleagues, to our partners in the voluntary sector, to all our stakeholders, and to people in our communities who worked with us. And thank you for your hard work and what you have achieved in really quite extraordinary times. You've done your very best for people in South West London. It really was an unprecedented year, and I saw many people in the CCG go above and beyond. People were resourceful, motivated and committed in the face of really very significant challenges. And it's only been possible for us to achieve so much because our teams across the whole system have contributed not only to dealing with the pandemic, but to continuously improving the quality of healthcare for our residents in South West London. So at the beginning of this meeting, I explained that we have recently been established as the South West London Integrated Care System. And our next presentation is from Sarah Blow. She's Chief Executive of our new Integrated Care System. And Sarah's going to talk through what the ICS is and what it means for delivery of health and care services for local residents in South West London. Sarah, thank you.
Thank you, Nicola. And just because everyone else has said thank you, I was actually going to start with a thank you. So I think I should as well, because we have successfully transitioned from a CCG, from South West London CCG, which was a successful CCG, into our new integrated care system in South West London. And the reason I do need to thank people is because many of the CCG staff did transition over through a 2P arrangement into the new organisation, but also the leadership across the CCG, from the CCG board and from the clinical leaders within South West London, helped us to make that a safe transition through into the new organisation. And let's be clear that we are actually evolving a lot of the work that we were doing in South West London within the ICS. So I think it's important to say that. Can we go to the next slide, please? Okay, so what is an integrated care system? Well, it brings together all of our partnerships across South West London, and we have 4 key purposes: to improve outcomes in our population health and care, to tackle inequalities in outcomes, experience and access. We need to enhance productivity and value for money, which is very important at the moment. And we need to support broader social and economic development. And that's a new area, I think, for the NHS, where we're actually broadening our responsibilities when we are working jointly with local authorities, voluntary sectors, and all of our partners in the community. If we can go to the next slide, please. So what are integrated care systems? Well, it's a new statutory organisation, but it's made up of 2 parts. I'll talk to you about who does what in a minute, but we have an integrated care board, and the integrated care board actually has the NHS budget, and it brings together partners in the NHS and others, and with a real focus on ensuring that we improve people's health and we develop together higher quality care and better value for money for the NHS. But we also have a second part of the integrated care system, which is new, which is an integrated care partnership. And that's where we come together with all of our other partners, local authorities and our voluntary sector and others, to think about how we develop a strategy to improve health and wellbeing for South West London. We actually have a really strong working relationship in South West London with our local authorities, and so it's really important that as part of an ICS, that is a joint way of working. So bringing together people in the ICP and ensuring that we work together on population health is an important part of what we do. But in South West London, that means also working very closely with our 6 places. We know that a lot of people do not recognise South West London as a thing. They live in Croydon, they live in Sutton, they live in Merton, Wandsworth, Kingston and Richmond. So we need to make sure that we join up with those very local services and organisations to make sure that we engage with the local community and we really develop the role that we have around supporting health and wellbeing in our local populations. And then we have something new now in ICSs called provider collaboratives. And this is where NHS providers come together, work at scale in order to deliver best outcomes for local people. And I'll talk to you a little bit about that in a minute. Okay, if we go to the next slide. Okay, so we actually became an integrated care system in 2020. This was before ICSs were statutory, and we were, I think, a wave 2 ICS at that point. So we were already working very closely together with our local organisations and our 6 places. If you would move on to the next slide. And this is just a bit of an overview of South West London. Now, we currently have about 1.5 million, but that's increasing our population as we move forward into the future. Around 4.7 billion is our budget, which may well grow because we are going to take on additional responsibilities from next year, including specialised commissioning from NHS England and dentistry, optometry and pharmacy, which is currently held nationally. We have 6 London boroughs. You've got some information there about our residents. And I think it's important to note that we have over 180 GP practices, but look at the workforce in social care in comparison to the NHS. So we have a huge workforce out in our care system that we also need to work with. And the NHS probably in the past has done less of that. So it's how do we work together with our health, social care and our communities. If we can move to the next slide. Okay, so important to recognise that actually this has been an evolution for us in South West London. I've been in South West London for 6 years, and you know, we have really worked hard to have an integrated approach with both our local councils and our other partners. And I think we've built that up through local health and care plans and development of our refresh of our long-term plan that we did a number of years ago. But also we've been together throughout, as Karen said, what has been a really difficult time throughout the pandemic, and it has strengthened our partnership and ways of working. And here we are now in a position where we can really push forward with the integrated working that we've developed over a number of years into our new ICS and our new integrated care boards and partnerships. If we move to the next slide. So our integrated care system, as I said, is made up of two parts. One is the integrated care board, and as I said, that is responsible for the NHS budget in our area and the plans that we have to put in place with that budget to improve people's health, deliver high quality care and value for money. And as you can see, the members of the board are set down there, and some of those members are actually on the call today, so welcome to them. And then also we have the integrated care partnership, which is made up of members throughout our community. It's quite a large group, but really important that we engage with everyone. We've also agreed that through the partnership, if we need to do additional works, that we will actually involve more partnerships through more partners through informal groups and also through task and finish groups. So if we had to do something, say on community safety, we would involve the police and others. So there's an opportunity for us even to widen this partnership even more. If we go to the next slide. So important that we recognise that we do have 6 places in South West London, and we work really closely at a place level with all of our partners. And what this sets out is some of the partners that are within our 6 places. If you can go to the next slide. And we also have these provider collaboratives, and our provider collaboratives are doing really well in South West London. So South London Mental Health Partnership, which comprises of Oxley's, South London and Maudsley and South West London and St George's, have already taken on delegation from NHS England for some budgets in order to bring high cost placements from out of area into the local community and to support them in South London. And they've also been working together around joint services and back office, and are currently developing a community strategy for South West London as part of the collaborative. The Acute Provider Collaborative, which is made up of our acute trusts, so Croydon Health Services, Epsom St Helier and St George's hospitals and Kingston Hospital, have been working together again for a few years. They also share back office, but they've really supported us throughout the pandemic, and particularly in our recovery. And I know that Karen talked about the fact that we are recovering our elective care, and we are doing very well in that in South West London. Always more to do, and this has been a really difficult time, but we are, compared to national, we're doing very well in South West London. And RM Partners, that's Royal Marsden Partners, and that comprises of all of our NHS providers in South West London, as well as the Royal Marsden, and that brings together primary, acute, specialist providers and screening services to make sure that we have a whole pathway approach for South West London for cancer patients. And again, RM Partners have been in place for some time and have been successful over a number of years. So we want to continue that. We recognise there's huge pressures on all of these provider collaboratives, but we're confident that they are in the right place to take us forward for the future. If we go to the next slide. So I was told I've got to be really fast on this, but I don't have to be too fast because Karen already stole my thunder and already talked about some of these fantastic initiatives that are happening. And this is because we have taken forward work across each of the boroughs through the local health and care plans. So let's go to the first one of those. So Croydon's Hospital in a Hospital, I am not going to talk about because Karen's already covered, but you will have all of these slides at the end, and there's a bit more information on each of the slides about some of the work that's going on in each of the boroughs. So if we go to the next slide. So Kingston's virtual wards, I would tell you that we are doing virtual wards across South West London, and we're building them up going through to the winter to ensure that we can support people in the community. And these are clinical and digital support that we've put in to support people in their own homes. And there's more information, as I said, on the slides. If we go to the next slide. Long COVID fog in Richmond. This is where the Community Healthcare Trust, Hounslow and Richmond Community Healthcare Trust, have set up a community COVID service, which is helping people with therapies to support them as they come out of the long COVID. Next slide. Sutton's Crisis Cafe. We actually have a number of crisis cafes across southwest London, but this is about where we have opportunities for people with mental health issues to go along to the cafe, and not just in crisis, but also to be able to support them on a regular basis. And they've had a number of there have been over 100 people that have been supported by the cafe, and almost 300 one-to-one crisis support sessions that they hold within the cafe. So it's a real opportunity for local people, and it's self-referred, so people can walk in when they need to get some support. And we've got a number of these, but this is the Sutton one. If we can go to the next slide. This is a fantastic collaboration with the charitable sector, but also with students who are doing a walking challenge. And again, I'll let you read more about that, but that's work in Wandsworth. And the pedaling paramedic, this is Matt. Matt is working with one of the PCNs in Merton, and he's actually visiting people at home that would normally be ringing their GP and maybe can't get to the GP practice, but he also sees people with the GPs. But also it's a joint piece of work with LAS. So part of the time Matt works with LAS, pedaling around, seeing people who've dialed 999. So this is a fantastic joint piece of work with London Ambulance Service and one of our primary care networks in Merton. If we can move on. And these are some of the Southwest London pieces of work that are happening. So we have actually done a lot around elective care. And what we're doing is we're looking at where we can speed up, particularly where we have what we call high volume, low complexity operations. So things like cataracts. And what we've done is we've carried out more than 1,000 extra patients in Southwest London, thanks to the way that we work together within the Acute Provider Collaborative. Okay, can we go to the next slide? And vaccine confidence. Again, Karen already mentioned this, but a huge amount of work went on within individual boroughs on trying to support people in the community. And I think the work that this has been done in all 6 boroughs, working with local authorities, working with community groups. So I think it's important that we highlight some of that fantastic work. Okay, next slide. Okay, so we're going to hand over for Q&A. I did do a whiz through, but I am assured that these slides will be available for people to look at in more detail after the meeting. So Charlotte.
Great, thanks presenters, some really good work there. So we have got some good time for questions. So we've had no written questions in advance. So if you'd like to ask a question or actually make a comment on what you've heard, you've got 2 ways to do it. So you can raise your hand using the little reaction button at the top, or you can write it in the chat and we can sort of alternate between the 2. So do we have anybody who wants to raise their hand? Ask a question. Oh, Liz, I think we've got Liz from Kingston Health Watch. Off you go, Liz. Oh, are you there, Liz?
Sorry, yes, I was took a time to find my unmute. Sorry about that, Charlotte. Okay. Yes, I've represented the 6 Southwest London Health Watches at the CCG, and I just wanted to raise a couple of points. And the first was how useful we have found the additional engagement that we've had, Charlotte, with yourself and other members of your staff. And to just take an example would be the movement of some of the renal services, and how you talked through with us about what that entails for people and exactly what consultation was being held. And I think we had the opportunity to see the questionnaires, for example. And so I thought that was a really good example of the dialogue between the 6 health watches and yourselves, and how that can add assurance really to the changes that are being made. So that was just one observation. And the second is in relation to the over 470 additional clinical roles. And I was wondering whether a piece of work has been done to just gauge people's understanding about skill mix in primary care, so that people understand what these different practitioners bring to the mix, which personally, I think is very enriching, but it's important that people understand what this skill mix means in order that it can be used most effectively and people feel, you know, very confident being seen by different ranges of practitioners. Thanks.
Lovely, thank you, Liz. Thanks for those comments. Healthwatch always a really helpful source of advice, you know, good critical friend. I think we need to continue that, and I know we will. Nicola, I think, would be best placed to talk about the new roles in primary care. Nicola, do you want to take that one?
Yeah, thank you. Thank you for the question, Liz. And it is a really important evolving element of primary care and how we're working, you know, not just differently in practices, but with practices working collaboratively in these primary care networks and having staff who work with patients in individual practices, but they also work across the group. So some examples for people who aren't fully aware of this, some examples of how this happens is we have some practices who employ pharmacists who are looking at how to make sure that, for example, older people who are on multiple medications get their reviews in a sort of structured, systematic way, so that this is, you know, done throughout the year and raises the standards, the quality of the prescribing, as well as seeing patients on a daily basis. So, and we've got paramedics working in primary care, and we've got first contact physios working in primary care. So there's lots of different roles there. And actually, it's really important that patients, people attending their GP surgery or contacting their GP surgery, do understand what these roles are. So I couldn't agree with you more that it's needed. We haven't done that at the moment. It's still quite an evolving picture. And not every PCN has the same configuration of staff. So there are some PCNs that have got quite a few pharmacists, and there are other PCNs that have got a team of paramedics who are busy doing long-term conditions reviews and home visits on patients. So there isn't a one-size-fits-all with this, and so consequently I think it might be quite a complex piece of work. But I do agree that it's going to be very important that people understand that these new roles are an integral part of general practice, and general practice isn't just GPs. We've got a lot more to offer than that, and they very much support the existing practice workforce. So I'm going to take that on board, and we'll think about how to do that as we go along. And I think it's going to be work in progress.
Lovely. Thank you, Nicola. Great questions. Thank you, Liz. Has anybody else got any questions or comments they would like to make? No? Okay, so obviously the slide deck will be online, as will the recording. So if you do have any further questions, you can come back to us, can't you, through the usual routes. Last call for questions? No? Okay. Nicola, shall I hand back to you to close?
Yeah, thank you, Charlotte. And thank you for Liz for your question. It's always, you've got to be brave to put your hand up in a meeting like this, hasn't it? So I appreciate, you know, we're all still here, we're all still working in the system going forward. So lots of opportunities to be able to engage. So this now concludes the final South West London CCG annual general meeting. So as Charlotte said, if you would like to watch the meeting recording, it'll be published on the ICB website. And thank you very much to everyone for joining us today.
Thank you.